Hi, welcome to our Medicare 101. I'm Diane Kubik.
And I'm Ashley Maldonado.
And we are your aligned brokers. We work alongside Pioneer Physicians Community Healthcare, and we're here to talk about Medicare, what it covers, what it doesn't cover, how do you get Medicare, how do you enroll in Medicare, different options for Medicare, and some different really important things you need to know before you proceed further.
We are aligned brokers with seniors. We actually focus on the senior market in particular. We help people with things like life insurance, as well as protecting your retirement savings, and things like short-term care and long-term care, along with Medicare, because believe it or not, a lot of times those things actually all work together. And so it's important to work with somebody who understands how those function. Diane and I are here to help you at no charge. Why don't you dive into that a little bit?
Well, first of all, it's really important, I want people to understand, it's important for them to have their own broker. That means a person that is trusted, a person who's skilled and experienced, that can walk alongside with them as time goes on, so that they can understand if things change, that person is there. We are contracted with all of the different plans that your doctor is contracted with, and so we can take a look and to find out what is the best coverage for you. So with this presentation, we would invite you to write down your questions and your concerns. We're going to, after we wrap up, we're going to take your questions and try to answer those. If we don't know the answer, we'll try to figure it out together.
We'll find out.
So our session is here. We're here. We will invite you, if you'd like to sit down one-on-one. We have an office in Uniontown. We can meet you there. We can meet you in your home, or at my second, third, and fourth offices at any Panera in the Tri-County area.
That's exactly right. We'll meet you where you need us.
That's exactly right. So
you know what? Let's give them our phone number.
Oh yeah. Okay. So I'm Diane, and my number is 234-380-9070.
And I'm Ashley again, and my phone number is 330-815-1204. And I always brag because the phone number I give my clients, and her too, is the same numbers that our children reach us on.
Exactly.
So we don't have a phone number that goes to a secretary at an office that nobody ever answers. We stand by everything that we talk about, and we give out our own personal phone numbers.
So first question, do I have to enroll in Medicare? Well, the answer to that quite specifically is you don't have to do anything, but do you want to do that? So that may have a lot to do with what is your current coverage. If you have employer coverage, it may be wise for you to enroll in Medicare. In fact, your employer might require that you enroll in Part A and B. If you're already taking Social Security, you'll be automatically enrolled. If not, you'll have to write a check, or you'll have to pay the premium for Medicare. But it makes great sense for you to really investigate what are the differences between what your employer coverage is offering as opposed to a Medicare plan. That is something that some people overlook, much to their discretion. They have missed an opportunity maybe for savings, cost savings.
Mm-hmm.
You have to take a really good look and do the old Ben Franklin and put that side by side and really look to see what's offered now. Also, if you have VA coverage, you have to remember that kind of coverage has limitations. It is a network, and I have lots and lots of clients who have both VA and Medicare, maybe a Medicare Advantage plan. So really important to know. What's important to understand too is some people will say, well, I don't take any medications, or I just don't want to sign up for this. What you have to remember is that if you miss the opportunity, there are certain times to sign up, and you can get stuck with a penalty if you don't sign up when you should, and that penalty stays for as long as you are here. So you have to be really conscious. Just because you didn't want it, you might take a look and make sure that you should or should not have that.
You know, we're all just one doctor's visit away from needing a really expensive medication anyway. So it's the responsible thing to do anyways.
Okay, so as we go on, we're going to jump into different parts of Medicare. Why does A and B plus D equal C? What's a Medicare supplement? And which one is appropriate for you? So let's take a look and let's jump into Medicare Part A, Ashley.
Well, yeah, actually, let's talk about how do you even qualify for Medicare? You know, we both have 20-year-olds, people in their 20s on Medicare. And so it's not just for individuals that are 65 and older. If you've been collecting Social Security disability payments for 24 months or more, odds are you're going to find one of these red, white, and blue cards out in your mailbox.
Exactly. You can also, if you're diagnosed with ALS, Lou Gehrig's disease, you can get an instant qualification for Medicare. Also, end-stage renal disease. Let's say a former spouse. You can qualify from a former spouse. Let's say you have teachers, state teachers retirement, or you have public workers. You can actually qualify based on your spouse's record.
Yes. If you're 65 or older and all those other things, or you have to have 40 quarters for your Medicare Part A is basically what she's saying. You have to have 40 quarters of a work record. Again, an ex-spouse, a parent, anything like that would entitle you to Medicare Part A at no cost. Otherwise, it's got a really hefty monthly premium. So Medicare Part A includes 4 different pieces. It has inpatient hospital, hospice care, some limited home care, as well as skilled nursing facility.
And for most people, the premium is 0. There are some people who can buy into that kind of coverage. Now, so Part A, hospital coverage, it is when you've actually been admitted to the hospital. You can be on Part B and be under observation. At least they now have to tell you that you're under observation. But it is inpatient hospital coverage. It has certain deductibles, and it can happen several times a year. In addition to that, it's skilled nursing. So skilled nursing is a skilled level of care. You're in for a time. There is no part of Medicare that will cover long-term care. This kind of care is where you're benefiting from a treatment, you're climbing the uphill ladder, you're getting better, or they're preventing you from decreasing. They're preventing you from getting worse. This kind of coverage will be at 0 cost for 20 days. And then after that, you'll have a daily copay up to 100 days. The third part of Part A is hospice care. Tell us a bit about hospice.
So hospice is when you're terminally ill, and it's only for a limited time that they'll actually send somebody out to your home, or you can opt to go to a hospice facility if you prefer. But when they come out to your home, it's just a couple of times a week here and there to help your caregivers take care of you. There's no cost associated with it, but it's important to understand that there's some definite limitations in there.
Sure. If that time period went on and on, I've had clients who've had hospice care for 9 months or so, and your primary caregiver can be a husband, it can be a wife, it can be a family member. They are taught how to care for you. So remember that original Medicare does not have provision for long-term care. That is self-pay, or it can be Medicaid. We do have plans available to cover for that kind of coverage. If that's interesting to you, jot that down and we can talk to you about that. That happens actually quite often. So the fourth part of Part A is home care. Home care is where you've been in the hospital, they've released you, and you need further types of assistance. You're getting better, maybe you have a catheter or a port, you need further occupational physical therapy. They're there for a short period of time to help you to get back on your feet or stable. There is 0 cost for that kind of care as well.
Absolutely, and that's at the doctor's discretion. So it's not for a long period of time, and that can kind of vary based on what kind of care you need. So keep that in mind. So that's Medicare Part A. Another form then of Medicare is Medicare Part B, that's where you do have a monthly premium generally, and it's based on the income that you report to the IRS 2 years ago. So the IRS and Medicare kind of get together and determine what category your income falls in and what premium you would pay based on that. So make sure you keep that in mind if you receive an inheritance or sell property or move qualified funds. Sometimes that's a taxable event that can impact your Medicare premiums in the years to come.
Exactly.
Some people actually qualify to have their Medicare paid for by Medicaid. If your income is low enough, the state of Ohio will oftentimes pick up your Medicare Part B premiums for you.
Exactly. So if that's something that you're interested, you think you might qualify, we can help you with that. We can look at the parameters around that, the income, and actually help you to make the application to do that. Bear in mind also that higher monthly premium you might pay for Part B is just for a time. So they'll look back 2 years on that. There's an appeal available, and it's not forever. Okay, so if your income goes down, then your monthly premium will go down. That monthly premium can go up, it can go down. It's supposed to be linked to the cost of living, so that can change every year as well. Now, so that's original Medicare, and so Part B is things like outpatient surgery, things like a nurse practitioner, you go to the doctor's office and you have physical therapy or occupational therapy. People who are assisting, if you have an outpatient surgery and you're not actually admitted to the hospital, that's a Part B.
Durable medical equipment and supplies, those are considered Medicare Part B. So Part B, you do have a monthly premium generally based on your income. Some people have higher, some people pay lower. And then you also have a small deductible that you pay. And then after that, it's an 80-20 cost share. Medicare pays 80, which is by and far the bulk of the bill. You're left with 20%.
That's not so bad, right?
Well, the doctor, but if you're at the hospital, that's a different story. Chemotherapy, 20% of that can get really pricey.
Really pricey. And the thing that you need to remember, that's really important to remember, is there is no max out of pocket. There's no roof on the house. And I personally don't think that I could sleep very well. I've seen this go very badly. When there is no maximum out of pocket, it can get really risky for you and very expensive for your beneficiaries if you should pass away, because that stays as well.
Absolutely. A lot of our clients are on a fixed income, and so it's important to know what you're getting yourself into with original Medicare. There is, like she said, there's no roof on the ceiling. So keep that in mind. There's no limit to the cost you could be held responsible for. And there's also some limitations here with Medicare. We didn't cover. What does Medicare cover for dental?
Yeah, so unless you get in a car crash, probably nothing. Okay, most likely nothing for dental and vision and hearing. So things that most people need, those are not included. Part D, which is its own separate drug plan, is not the chronic medications. It's not covered by your original Medicare. So you have to have provision, or at least the wise people do, for prescription drugs. Those are medications you take every day, like blood pressure meds and other statins and things like that. There are some specific Medicare drugs that can be under Part B. Those are administered by doctor's office most often.
Yeah, you're not going to the pharmacy for Part B drugs. So
No,
the ones that you go
absolutely.
pick up at the pharmacy are covered under Medicare Part D. Those are administered by private insurance companies, and they all cover different medications at different prices. And so you really owe it to yourself when you're signing up for that coverage to make sure that it's going to cover your medications and that you're not overpaying for those too.
Exactly. So that's A and B, which is original Medicare, and D. What if we put all that together? Then we arrive at a C.
Sure.
Okay.
So these Medicare Advantage plans, also known as Part C, they kind of function a lot like an employer plan, if that's what you're familiar with, where you have networks and co-pays. but they do have little to no premium.
Right, and people like them very much. They're becoming very popular. They're very value laden, so they may include things like dental, vision, and hearing, over-the-counter items and transportation. Some of the things you've heard on the TV, those can vary plan to plan. Remember that these plans can vary county-wide. They can be very different in different parts of the country. We will look and ask you lots of questions to make sure that your doctors are covered and your medications. Look at things like your dentist and your optician and find out, is one of these Medicare Advantage plans, which are pay-as-you-go up to max out-of-pocket, is this the right kind of coverage for you?
That's exactly right. Now, Diana, do you have to pay for your Medicare Part B premium?
Absolutely. With any of the options that you have, which are either an Advantage plan or a supplement, which we're going to get into next, a Medigap plan, you do have to continue to pay for your Part B premium. So if that kind of coverage is interesting to you, we can take a look at that and see if that works for you. Bear in mind you have no underwriting, no health questions with these plans. The other kind of coverage that's available to you, specifically when you're turning 65 or if you're going off employer coverage, there are no health questions. They're a guaranteed issue. They're called a Medigap or a supplement. So let's talk about that next.
Yeah, those are a secondary coverage to your original Medicare. So people who have a Medicare supplement or a Medigap plan, when they go to the medical facilities for whatever reason, they're presenting both their original Medicare card, that red, white, and blue one, plus their supplement card. The supplement basically helps offset the cost that you would otherwise be exposed to on original Medicare.
Right, so this kind of coverage is designed to cover the cost that Medicare, or for the most part, there can be deductibles of what Medicare didn't cover. Bear in mind that this kind of coverage will not cover any kind of benefits other than what original Medicare covers.
That's right. That means no dental, vision, or hearing on the supplements.
Right.
You would need to purchase that on your own as well as a prescription drug plan.
Right. So you go to your doctor and you give them your original Medicare. Here's my secondary. Then you have a drug plan, and then you have typically a dental, vision, hearing coverage, which we can help you with as well. So unlike the Advantage plan, which we talked about, the Part C, that has one card. Okay, the Medicare supplement is for the just in case. So think, I just want the bill paid. There's no network. I just want to have the bill paid. It is appropriate for a lot of people who have really heavy duty chronic conditions. That can be, a really wise choice. If there's no underwriting, that kind of coverage may suit you really well. If you don't choose to take that kind of coverage now, in time, if you chose that later on, there would be health questions.
Absolutely. They can decline you or charge you a higher rate based on your health. It's also important to know that these supplements have a monthly premium, and that premium is going to go up each and every year.
Up to 5 to 12%. So calculate that over, let's say, 8 or 10 years. It can get very pricey, and then you've got to remember you've got the drug plan and the different other kinds of coverages that you need. So if you want to take an in-depth look, sometimes it gets tricky. Honestly, we sit with our clients and they're not real sure what to do. We can help you to weigh through those different kinds of coverages.
It's important to sit down with somebody who knows these plans, who works with every single one that your doctor's office works with, and the supplements, and help you kind of line them up side by side and make an educated choice. You owe it to yourself to take everything into consideration, and that's what we're really good at.
We are, we're here for you. We're not going to charge you. If your employer coverage is the best kind of coverage for you, we're going to help you to figure that out now. More and more people are working, and they're continuing to work. Write down our number again, and we're going to give it to you again.
Sure. Mine is 330-815-1204.
And mine is 234-380-9070. We are your Aligned Brokers, and we're here to help you. So now we're going to open up the floor to your questions.